Hi, what's up guys? Welcome back to the channel Behind the Scenes in Health with Dr. Ron. And today on this interesting episode, I'll be talking about the interesting different specializations available in public health. Now, I get this question a lot. I'm in public health. I want to specialize. I don't know what areas are available. I don't know which one to get into and all of that. So that's all what I'm going to be talking about on this channel. And mind you, the list I'm going to be sharing today is not exhaustive, so there might be potentially other specializations out there that you want to check out. So the idea of this video is to show you what's possible, the interest areas, who you can work with or the organization you can work for, and what kind of roles are available for you in those areas. So grab your popcorn and let's dive into those specializations. Now, the first one on the list for me today, in no particular order, is epidemiology. Now, during the whole COVID-19 thing, there was like real demand for epidemiologists. So an epidemiologist is a professional who basically studies the patterns, the causes and effects of health and disease conditions in specific populations. They look at the distribution and determinants of the diseases in order to develop strategies for prevention and control. Now, they can work in research institutions, they can work in government agencies, they can work in NGOs, they can work in hospitals, and basically they contribute immensely to the understanding and improvement of public health outcomes. So if you're somebody who is interested in disease patterns and data analysis, then you might want to look at becoming an epidemiologist. Now, the next area is environmental health. Now, this is one of the areas a lot of persons don't really talk about that much, but it's very crucial because it's a branch of public health that is concerned with how our environment, both natural and human-made, affects our general well-being. So this area looks at things like air and water quality, food safety, waste management, occupational health, and the impact of different pollutants, on the communities and all of that. So if this is you're interested in pollution, sustainability, then you might have a career in environmental health. Now, the next one is health promotion. Now, interestingly, some schools, like I know Swansea University, offers the Masters in Public Health and Health Promotion. So health promotion is basically the process of enabling individuals and communities to increase control over and improve their overall well-being. And this is usually through areas like education, behavior change, and creation of supportive communities. Now, a lot of us are very familiar with Aproko Doctor and what he does across all his social media pages. He is doing health promotion. So if you're somebody who is passionate about education, you're passionate about community, you're passionate about preventive medicine and all of that, then you might look at health promotion. And now, some of the key components of health promotion include education, awareness campaigns, policy advocacy, and community engagement. Now, I'll use Aproko again as an example because he cuts across these four areas I just mentioned, community engagement, policy advocacy, awareness campaigns, and education. So you're not just looking to address specific health issues as a health promotion expert. You're just also trying to promote a holistic approach to well-being, considering the physical, mental, and social aspects of health, right? So that's health promotion. Now, the next one is global health. Global health is a field of study, research, and practice that addresses health issues that transcends national boundaries with a focus on improving health and achieve equity for people worldwide. Now, some of the key aspects of global health include infectious diseases such as pandemics. We use the COVID-19 as a very good example. We saw what happened. We saw how countries came together globally to try to stem the tide of the pandemic. So you're looking at infectious diseases, you're looking at improving healthcare access and infrastructure, you're looking at promoting health equity and addressing some of the key social determinants of healthcare. So in essence, global health recognizes that healthcare issues are actually interconnected and requires international collaboration and cooperation to address those issues, right? The next one is health policy. So you hear of people they call health policy analysts, health policy makers and all of that. So this is another interesting specialization in public health that you can get into. Now, as a health policy person, you're looking at the decisions, you're looking at the plans and actions which you take to achieve specific health goals or outcomes in the community, right? So it involves development, implementation, and evaluation of strategies and different initiatives used to improve overall health outcomes. Now, some of the key components of health policy, you're looking at things like legislation and regulation, you're looking at resource allocation, you're looking at healthcare delivery, you're looking at disease prevention and control, and you're looking at health equity. So these are some of the issues the health policy people look at, really. And ultimately, they play a very crucial role in shaping the structure and function of healthcare systems, both nationally and globally. So if you're interested in policy, then becoming an expert in health policy might just be a career option for you. Then another interesting area is maternal and child health. This is actually an interesting specialization in public health. Now, maternal and child health refers to the well-being and healthcare of mothers and children with a focus on ensuring safe pregnancies, childbirth, and overall health and development of children. That's what maternal and child health is really all about. Now, this addresses a range of issues, really, from infants, children, up to the adolescent period, and also covers the women from prenatal, up to postnatal period. So we're looking at prenatal care, you're looking at safe childbirth, you're looking at childhood immunization, you're looking at nutrition, you're looking at things like family planning. So it's actually a huge area and interesting area. So I think at the core of what maternal and child health aims to achieve is to reduce the maternal and child mortality rates, improve access to healthcare services for pregnant women, and enhance the overall health and well-being of pregnant mothers, really, throughout the life cycle. Yeah, this is very dear to me, but interestingly, I'm not in that space. Next one is biostatistics. Biostatistics is a discipline within statistics that focuses on the application of statistical methods to biological, health, and medical data. So basically, they get to collect, analyze, interpret, and present the data within the context of biological and health-related issues. So most of the study designs or research and all of that, so a lot of the biostatisticians actually play a role in that. They collaborate with researchers on study design, on data analysis, interpretation, clinical trials, so it's an integral part of, evidence-based medicine, really, because whatever their output, it support decision-making processes and contributes to advancements in medical knowledge and practice. So if this is you're interested in statistics and all of that, then you might want to look at biostatistics. Next one is nutrition. I think these guys are very underrated. So public health experts who specialize in nutrition, right? First of all, nutrition is just basically the process by which living organisms obtain and utilize the nutrients responsible for or necessary for growth, development, and maintenance of health. That's nutrition. So when you look at human beings now, you're looking at how food affects healthcare and well-being. So you're looking at things like the macronutrients, you're looking at the micronutrients, you're looking at balanced diet, you're looking at dietary guidelines, you're looking at nutritional requirements. It's a whole lot, really. So most times I say the nutritionists, they are not just advisors, really. They actually play more than that role in educating people. So for example, you have people who have chronic health conditions, maybe like diabetes or hypertension. Ultimately, their nutrition is going to differ, and who is better poised to advise than the public health expert who is a nutrition expert, right? So that's an interesting area to look at. The next one is occupational health. This is another specialty in public health or specialization in public health, where you focus on the well-being and safety of workers in the workplaces. So it involves the identification, assessment, and control of workplace hazards, and promotion of health and safety practices to prevent work-related injuries. So, as an occupational physician or occupational health expert, this is what you're doing day to day. You're going and you can work in different sectors really, because you're looking at things that could lead to workplace injuries and find how to mitigate those things. Now, some of the key aspects include workplace hazard assessment, occupational medicine, design and delivery of health and safety programs, ergonomics, and occupational health surveillance. This is a huge one. You might just want to go read about these components I just mentioned about. So, occupational health professionals, generally, they work with employers, employees, and regulatory agencies to create workplaces that prioritize the health and safety of workers. So if this is you, you're passionate about workplace safety, then you might want to think about a career in occupational health or a specialization in occupational health. Now let's look at infectious diseases. So infectious diseases basically are disorders caused by pathognomic organisms. This could be viruses, it could be bacteria, fungi, or parasites. And the key thing about infectious diseases include looking at what are the causative agents, what is the mode of transmission of that illness, what are the prevention and control strategies available, what's the global impacts. Let me use COVID-19 for example again. You saw how COVID went across the whole globe. And what are the emerging and re-emerging diseases? So sometimes you might control a pandemic or an epidemic, but there's also the potential for that same disease to occur again. For example, in Lassa is a seasonal problem we face here in Nigeria, Lassa fever, right? So you could look at that. So understanding the causes, the transmission, the prevention and infection of diseases is very key for public health efforts to manage and control these conditions very, very, very effectively. Now, mental health. You have public health professionals who specialize in mental health. And mental health refers to the emotional, psychological, and social well-being of individuals. You're looking at how people are able to manage stress, relate to others, both at home and in the workplace, make decisions, and generally cope with the challenges of life. So good mental health ultimately contributes to good satisfaction and better quality of life. So as a mental health expert, you're looking at emotional well-being, you're looking at psychological well-being, you're looking at social well-being, you're looking at coping skills, you're looking at mental disorders, really. So promoting mental health involves creating supportive environments, reducing stigma around mental health issues, and generally providing good access for care and support, really. So you can't discount the work of the mental health expert. So this is a key one, especially in abroad or first world countries. A big issue. They are looking for mental health experts, big time. Then you look at maybe the last but not the least is health informatics in public health. So there's actually a branch of health informatics called public health informatics. Now, using informatics in public health, you're basically using information technology and data science to collect, manage, analyze, and present, and then ultimately disseminate information for the purpose or the sole purpose of improving public health outcomes, right? So some of the key things you're looking at if you're considering public health informatics is data collection and management, disease surveillance, health promotion and education, telehealth and mobile health, then probably decision support system. So health informatics in public health actually plays a very key role in enhancing the efficiency and effectiveness of public health efforts, right? Now, all of these specialties are described today, just giving you an overview. They can work with hospitals, they can work with government bodies or agencies, both at the national and international level. They can work for research facilities. I mean, there's a whole lot of places they can actually work with. So any specialization you get into, be rest assured that yes, you get somewhere to fit in. So if you enjoyed this video about the different public health specializations available, please give this video a like. Please share this video once you're done with your friends, your colleagues, so that they can enjoy the good information we share on this channel. And yeah, that's it from me. So if you have any comments, I'm happily reading in the comment section. So drop the comments in the comment section and I'm happy to read and reply to you. So if there's any topic you want me to talk about, you can always put it in the comment section. Right, that's it from me on today's episode, and until I see you in the next episode, remain safe, remain calm, and like I always say, bye for now.